Hello, AP students. This is Mrs. Politsky, and I have notes for Chapter 12, Psychological Disorders, and we're going to focus in on schizophrenia. Schizophrenia is basically a psychotic disorder. Anytime we talk about psychotic, this is when an individual kind of loses their sense of reality, involving distortions in thoughts and perceptions or emotion. Everything appears in a confusion of multiple realities, layered with hallucinations and delusions. Emotions often become blunted, turn bizarre, and language takes strange twists. Memory may also become fragmented. More than 1 in every 100 Americans, or more than 2 million Americans over the age of 18, will become afflicted with this disorder. The first appearance of schizophrenia typically occurs in men before the age of 25. For women, it's a little delayed. The first appearance may begin maybe around age 25 and may exist kind of through the 20-year pattern of age 45. Schizophrenia has consistently been the primary diagnosis for about 40% of all patients that have admissions to public mental hospitals. Schizophrenic patients typically require prolonged or recurrent of treatment. They can be expected to occupy about half of all the mental hospital beds in our nation. About a third of all schizophrenic patients will never recover, even when they have the best therapy, which might include like drug therapy. There are some different types of schizophrenia, and so we're going to talk about some of the types that are on the spectrum for these individuals. The first is the disorganized type. An individual who might have this form of schizophrenia has incoherent speech. They may suffer hallucinations and delusions and have bizarre behaviors, such as talking to imaginary people. Another type is catatonic type schizophrenia, and this is primarily a motor dysfunction, meaning that you're a muscular dysfunction. Individuals with catatonic stupor, they might remain motionless for hours, meaning that they will sit in kind of a awkward position, and they will hold that position kind of like a statue for days, becoming very rigid-like. Then there is catatonic excitement, where a patient becomes incredibly agitated and hyperactive. They could be bouncing off the walls. This might be a situation where a patient might require some kind of restraints, such as like a straitjacket. Another type of schizophrenia is the paranoid type. Individuals that suffer from this have delusions and hallucinations, but no catatonic symptoms. None of the incoherence as far as the speech is concerned with disorganized schizophrenia. The delusions of persecution or grandiosity, which is when a person thinks like they are incredibly important, such as maybe they feel like they're so important, like they're as important as the president or a governor or such. There is a lot of illogical thought that is involved in the paranoid type. Another example is undifferentiated type of schizophrenia, and this is kind of what we call a catch-all category. It's schizophrenia for just about anything else that doesn't fit into the previously mentioned categories. So an individual might have hallucinations and delusions, but they may have some of the catatonic excitement. So this is where we can, for the most part, identify individuals and to diagnose them. Another type is residual type schizophrenia. The diagnosis for individuals who have suffered from a schizophrenic episode in the past but are currently not showing any symptoms, such as hallucination or delusional thinking. So if an individual at some point in time has acted schizophrenic but they don't anymore, this might be the label that they are given. Most schizophrenic patients display a variety of symptoms, and we might hear about positive symptoms. This refers to an active process, such as an individual having delusions or hallucinations. The types of medication, drugs that would be used are typically antipsychotic drugs. Individuals who suffer from negative symptoms, this refers to a passive process of deficiencies, such as an individual who is socially withdrawn, or a poverty of thinking, meaning that they probably look and act a little bit like an individual who has major depression. Unfortunately, drugs do not respond, or at least antipsychotic drugs do not respond to the symptoms. Possible causes for schizophrenia. Studies show that adopted children with no family history of schizophrenia run no increased risk of developing the disorder when placed in homes with a schizophrenic parent. Support for this brain disorder view comes from many places. Antipsychotic drugs are the major tranquilizers, which interfere with the brain's dopamine receptors, can suppress symptoms of positive schizophrenia. Drugs that stimulate dopamine production can also produce schizophrenic symptoms. Brain abnormalities may also contribute to the risk of schizophrenia. The closer one's relationship is to a person with schizophrenia, the greater one's chances are of developing it. While only about 1% of the general public will become schizophrenic, the child of a schizophrenic parent incurs a 14 times higher risk. Schizophrenia requires biological predispositions plus some unknown environmental agent to turn on the hereditary tendencies, such as chemical toxins, like if an individual is abusing certain drugs, stress, or some factor that we haven't dreamed of yet. And finally, diathesis stress hypothesis. This is a proposal that says that the genetic factors place the individual at risk, while the environmental stress factors transform this potential into an actual schizophrenic disorder. Thank you very much.